Lesson number 16, Embedded and Aggregate Deductibles. Hi, it's Mike. How are you doing today? I hope you're doing well. Thank you for coming by. It's good to see you again. In today's lesson, I want to go over some insurance terms that, well, aren't exactly popular and really well known to the average consumer. As a matter of fact, they're basically hidden in plans, and I don't want them to be hidden to you. I want them to be open, and I want you to be aware of them. That is the reason for today's lesson. I don't want to make this long and drawn out, so what we're going to do is we're going to discuss each deductible, and I'll give you a short explanation of what each one means. They're not really that difficult to understand, but sometimes the wording in plans can be really fuzzy. So what I want is for you to understand these two terms, and once you understand them and kind of get your head around them, you will understand why they're so important to know. The first deductible we'll discuss is an embedded deductible. Now, usually in a HDHP, High Deductible Health Plan, the deductible, the embedded deductible that is, will be set up in one of two ways. One for the family as a whole, or one for each individual member of the family. If a member of the family reaches his or her individual deductible, the benefit coverage starts for that particular person. It's not like the deductible concepts that we're accustomed to in healthcare, where this is just a deductible for the whole family, which is known as an aggregate deductible. But right now, let's stay with the embedded one. With an embedded deductible, you can have a split plan where one person will meet a deductible first, and the remaining 3 or 4 or 5, however many family members, will have not met their deductible, so they will have to go on to meet their individual deductibles. So remember, with an embedded deductible, you can have one for the family as a whole, or you can have one for each member of the family. That's the way it goes as far as embedded deductibles. It's pretty simple when you look at it, but I just want you to get a feel for it. So that way, when you're reading your summary plan description and you see it, you'll recognize it and you'll say, oh, okay, I have a split deductible, and deductibles can go for your daughter, your son, your wife, yourself, whomever. Keep in mind, when one person with an embedded deductible, when one person meets their deductible, that's it. They receive benefits. The other members of the family do not, because they have not met their individual's deductibles yet. Keep that in mind. The second deductible is called an aggregate deductible or a contract deductible. Any family member can meet the deductible to start benefit coverage for the family. For example, you have a family with a $3,000 deductible. That means that they need to reach $3,000 as a family to start benefit coverage coming in from the insurer. That's when they start paying claims, once you've met that deductible. Remember, we've discussed this in previous lessons. Please go back and review those lessons if you have any further questions. The family deductible can be met by 1, 2, 3, however many family members you have. It doesn't matter. Remember, an aggregate or contract deductible can give you a longer time to wait until you get the benefits. So if you see that in your summary plan description, understand what you're getting into, and understand that if you, for example, have a $3,000 deductible with a contract deductible plan, you will have to meet that $3,000 deductible together, as opposed to the embedded deductible where you can just have one person take on the deductible by themselves and the rest of the family members not be covered by the deductible. Please keep these points in mind as you go about looking for an HSA plan, and then you combine it, of course, with your HDHP. Knowing these things will enable you to make better healthcare choices and better health insurance choices as well. That concludes this lesson for today. Any questions you might have, you can always put it in the comments or email me. And if you've liked what you've heard so far, please subscribe, like, and comment. Thank you for your time, and take care and be well.